People are always yearning for you to make them feel special, wanted, expected. Would you agree?
Yes, yes, yes. And one of the key things that you'll find about just people in general, not patients, just people, when you make them feel so involved and you interact with them, even when they're having a bad day, even when something went awry or they woke up on the wrong side, if you were just to express yourself in that way of just greeting, just give a smile. You're not giving a hug, just a smile. They will return it. Very few persons won't return a smile.
Welcome to another episode of the Irreplaceable Dental Team. Now, I always say to you, don't I have a treat for you today? Well, I'm changing it up a little bit. It's not a treat, it's a gem. And her name is Evadney Ramdial. Welcome, Evadney. How are you doing today?
Welcome to me. Thank you so much for being here with me. I'm spinning it around this time. Thank you so much for having me. I'm great.
Wonderful. Well, I know who you are and I know what you bring to the table, but I'd just like you to share a little bit with my guests so they understand what I mean when I say gem.
Thank you for giving me that adjective. Well, to begin with, I am not as young as you have made me look, so thank you. I have been in insurance. I'm a financial advisor by trade, an ex-banker by trade also, and I've been in insurance for over 30 years. Right now, I do training in corporate Jamaica in customer service, sales, and I am a bee farmer. So I do something sweet that you won't mind giving your patients. It's not sugar, it's honey.
I love that. I love that. So I love that you have so much experience in the people business. And I also noted that you have a master's in psychology. Would that help you a little bit?
Yes, my first and second degrees are in psychology, and I'm actually in the PhD aspect of it. So it's psychology all the way. So yes.
Yes. Well, understanding human behavior, understanding how we tick and what we respond to is so vital. Just interacting with people, but especially in business and more importantly, in the health industry where we provide care to patients who may not always be calm and relaxed, right?
Right.
So, Evadney, I have a quick question for you.
Sure.
What would you say is the right blueprint for customer service in a dental practice?
I'm glad you started it with that. That's a nice entree. For customer service, for a blueprint in customer service, I would want to put it down to a number of, I don't want to say 1 to 10, but first and foremost, I want to say telephone. I want to say, communication. I want to also look at empathy and, of course, attentiveness. I want to look at the personalized care that we give to our patients. Communication is key. And of course, another one, empathy. Empathy is oh so important, especially when we have to go in someone's mouth. And efficiency in what we do on a day-to-day basis.
Right. You've mentioned so many things and all of them go together nicely for our patients to feel well served and well supported. So this customer service thing, it's not limited to the front desk or the people answering the phones. How can we integrate that to each team member in our dental practice, integrate some degree of customer service?
Heather, when I look at it, okay, I want to give an example and maybe that can help to take home the point. I went to when I was in my teens, My mom would be the one taking care of my, my oral, care. Then I became an adult, and going into dating, of course, your teeth became, your mouth became very important. And what I found is that over the past 40 years, I have had to change up how I see and what I was able to receive from dentists over the time. That didn't reside and doesn't reside alone with the customer service person, which is, we think it's the receptionist, but it also goes beyond that. It goes to the dental assistant, it goes to the hygienist, it goes to the office manager, and of course the receptionist. And it also filters to the janitor, those who take care and clean our space. So it doesn't resonate. It's not a repository of just the receptionist who ought to give that warm, welcome, affable, joyous, energetic greeting. It spreads right across your team. It's a team effort. And throughout the time when we do customer service training, we say that the teamwork makes the dream work. It's something that is so well known. Absolutely. And it really is. It really is. Because I want to take you back to the telephone operator. The telephone operator was whom we normally call back then. Now we don't say telephone operator because that person does receptionist work. It's not just operating the telephone as the instrument. And as such, you will find some receptionists, they will make or break your company.
That's true.
Are we true?
Absolutely
right.
True.
They will make or break it, because the first point of contact is that time when it's either they didn't take up the phone on that, we normally say first to third ring. So it rings on, and somebody will have to shout, the phone is ringing, or can you take up the phone? And then if they take it up with an attitude and not one with a joyous, and I'm not saying you must be like this butterfly. No, you're going to really smile every time we pick up that instrument. And it is not just the receptionist. It is when it passes on to another person. They must also pick up and receive that call with some energy, some life inside of them. When I spoke with you, a week ago when we decided to do this, I did something. What did I do? I called a number of dental practices because whatever I'm doing, I like when it is science-based, maybe because I do so much research. I like when it is science-based. And I want to tell you, here's somebody, and they answered, so-and-so office, hello. And that was that. Another one answered, so-and-so, can I help you? That was that. And then it kept on like that. And one even answered, good afternoon, this is so-and-so. Can you hold a moment? And I said to myself, this cannot be what is happening in that space of just the mere being a receptionist, either in front or through the telephone. Because that in itself has told me that you don't care about me. I don't hear where I'm really calling. Let's say we call dental auxiliary. We need to say it with some form of anticipating that the person is worthy. I am worthy of you coming to me as a patient. I feel happy. I'm glad. I want your business. I want you to stay. Or if you're a current patient, I need you to stay. So we need to answer the phone at get-go and invite that person in and to stay and to even be what I call the evangelist.
Yeah. So we generally say that the person who answers the phone at the front desk is usually the first form of contact to the office. And one of the things that I'll do, one of the tricks to the trade, I tell my team, put a smile on your face when you're answering the phone, because a smile will always come through. And I was going to say earlier that one of the books that we studied as a team in my office is Excellence Wins by Horst Schultz. And he is one of the co-founders of Ritz-Carlton. And you know what he says, Evadney?
Tell me.
10 feet or less away from someone, greet them. It doesn't matter if you know them or not. Don't let anybody in your office feel like a stranger. And I think that we're saying the same thing using different words, but it's so important for the team to realize that people are always yearning for you to make them feel special, wanted, expected. Would you agree?
Yes. And one of the key things that you'll find about just people in general, not patients, just people, when you make them feel so involved and you interact with them, even when they're having a bad day, even when something went awry or they woke up on the wrong side, if you were just to express yourself in that way of just greeting, just give a smile. You're not giving a hug, just a smile. They will return it. Very few persons won't return a smile, and even then you still give it. And, another thing I find, which I have started practicing, and I used to practice it, but even more so now that I'm training so much, it's really trying to remember people's names. Their name, they say that that is the most beautiful thing in anybody's ear, just their name. So I will call, and I remember when I asked you some long time ago, what do you want me to call you with, by? You said, well, it can be Heather Dawn, so I gravitate to trying to learn people's name, because it makes them feel very warm and encouraging them to open up, that you care about me, and you may even know something else. As we go on in the talk here, we'll see.
So what I would share with you is we see our patients by appointment. And I will say, if you've made an appointment for John Jones at 10 o'clock, and there's a gentleman walking through the door at 10 o'clock, even if he's a new patient, chances are that's John Jones. So greet him by his name as he's coming through. Shock. Oh my goodness, do I know you from somewhere? No, we were expecting you, Mr. Jones. You are absolutely right. It goes a long way. I want to delve in on something else that you mentioned earlier. Can you speak a little bit more about empathy, especially for the dental team? Can you expound on that a little bit more for me?
Empathy. Now, empathy, we know it's basic, but something that is not practiced. Empathy, it's really when I feel you. I walk in your moccasin, I feel you, I see you, I hear you, I understand you. And so when we empathize, it is not sympathize, totally different. So what we're saying to the patient, what we're saying to the client, what we're saying to anybody whom we come in contact with and we're doing business with, I am empathizing and I'm expressing myself. I'm feeling your pain. Now, if somebody were to call in, let me put a scenario. If somebody were to call and say, I broke my tooth over the weekend, and I know you don't have space for me today. When can I come in? Now, I'm sad. Clearly, I am anticipating a no from you. Remember now, because I know that I don't just call the same day and get an appointment just like that, because of how the practice is. You make an appointment a week in advance, 2 weeks. This is an emergency. No. If it is that the person on the other side, the receptionist or whomsoever got the call, is just going to say, let me check and see when you can come in. Being very polite, not in any way angry. Let me just check and see when you can come in. And they go and they say, okay, the earliest doc can see you is on a Thursday afternoon at 2. And the person says, okay, and that's it. That is not empathy. What your receptionist or the dental practice, what they need to understand, now this person is feeling pain. This person is sad. This person has some, it's a psychological thing going on right now. It may even be emotional. So I need you to empathize with me and say, oh, really? Really? And say something. Empathize with me. And how do you feel? And what happened? I am not going to encourage a 10-minute discussion on it because I know the practice has to go on. You cannot spend 15 minutes empathizing when persons are in front of you and somebody else needs to, access the phone or whatever it is. But it would be good if you just show some interest in the person's dilemma, in the trauma that they're feeling. Right.
Absolutely. And I tell you, the cheat code to that is in many offices, what we do is during our morning huddle, which is the time we spend together in the morning, just organizing the day, we will identify times in the day where if somebody calls with an emergency, we can see them at that time. Because, when somebody's hurting or there's some trauma and there's bleeding and a tissue is torn, whether it is soft tissue on the lips or whether it's a broken tooth or something, that's not likely going to wait until the next day or next Thursday. So being able to ask critical questions to get a clear understanding as you show empathy so that you can go above and beyond. Absolutely. Right. We're on the same page with that, Evadney.
I'm glad you have the cheat code. And I hope your audience will understand that is something that needs to be embedded, inside the practice so that the patient is not seen as if they're infringing on your time and not being, special, given that special treatment. Yes.
Got you. So what are some common patient concerns that the team often misses?
Okay, so some of the things that you will find happening is that the patient may be concerned about, okay, let's take it from the back end, post the visit. So I would come in, I'm taken care of, and there is no follow-up apart from setting my next visit. So I feel that, and I've had it done to me on 2 occasions where I do have follow-up, where somebody will call and say, Mrs. Ramdial, you're okay with, whatever. And I'm not talking about a regular clean. I'm talking about any other intricate procedure that the dentist may do, or even the hygienist might have done, depending on, the level of complication or intricacy. And they actually call me and say, are you okay? And it made me feel good. So sometimes when you don't get that call or nothing is happening or nothing in between then and my next visit, it's like I feel that, I am just a dollar figure. And I know that's not your practice, but I'm telling you, it has happened. And it happens out there. The post-care, the follow-up, ensuring that something else is there. Another thing that I think would be nice, I see it happening in some offices, some dental practices, where it is that little comfort. It's a comfort and it's a necessity. Some practices will go the extra mile by giving a rag, by giving a massage, by giving some form of little care, you know. But some offices you walk in and you mention that you're here for your appointment, and okay, I'll be with you, and then they continue. So you're not told to have a seat, please have a seat. You're not told to, oh, would you mind, do you want to use the washroom? Something like that, which, you know, Heather, these are basic things that go a far way. I like when persons, you know, would treat me when I go to the office as if to say I'm coming to their home for the first time. You know, I'm a first time guest. So treat me like a first time guest.
Yeah.
So here I am. I enter the office. You can say, oh, Mrs. Ramdial, the washroom is over there, or something like that. That let me show that, because when you come to my home, most of the time, people will ask you, where is the powder room? Right, Heather?
Correct.
They'll ask you, where is the powder room? And you usher them to the powder room. And you don't have to tell them where to sit, because normally they're at your home, they'll have a seat. But sometimes they're there standing and you look around and then, you know, it is just that little, it's a slight classy thing to do. That elegance in office. You please have a seat over there whilst I, enter your details here. I'll be with you in a moment. Something like that. Not just one moment, please. There's a difference, right?
There is an absolute difference. And I wonder if you've been spying on us, because we really do have a list that is given to someone who has the duty of calling all our patients who've been giving anesthetic later on to make sure that they're okay. And for our patients, we also give them an emergency number that if after hours something happens, at least they can speak to someone and get some sense of direction. And you're right. We often realize that sometimes the dynamics at the front desk are a little hectic, but it's always important to put the person in front of you as your focus. Even if you cannot physically speak to them and you motion, just a minute, I'll be right with you. People appreciate that. So, various offices can figure out what works for them. In our office, you sign in and somebody ushers you to have a seat.
Right, I know that, right.
They'll come to you and we still do a temperature check. And
I'm going to break in right there and say to you that I love when what's her name? Short and Brown, when she does that aromatherapy thing in a jig. And it makes you look like you're at a spa.
So,
like you're at a spa. You're not there to look about mouth.
Well, we joke about that too. But yes, in the clinical area, whether you've just come out and you're waiting or not, we usher you to the seat and then let the front desk person know Mr. Jones or Mrs. Jones is seated, and usually they'll let them know. So, you know what? It's really just treating people the way you would like to be treated. That's what it is.
Yes,
and
it is.
What we call in the clinical area, if somebody's waiting, find a way to fill the gap. Whether it's offering a hand massage, that's Bridget, she loves to do that,
yes.
Or putting a warm neck wrap, or maybe just engaging somebody in conversation if they're anxious, conversation that has nothing to do with dentistry but brings a smile to their face because you know that they're always boasting about this granddaughter or that grandson or whatever. So filling the gap.
And that is where you find the empathy extending over into that area. You asked about empathy also, because how sweet is it when I visit the office and I would have told you maybe some time about that. Listen, I had an accident, or my son, or I lost my cat, or my grandma passed, or, my daughter had an accident, or something about my family. And I would have said that to you, maybe when I just arrived, or maybe the time, my previous visit. And how sweet would it be that when I enter into the office or when I sit in that chair, you were to ask me, so how is your grandma? Or
Correct.
how is your cat? And have you gotten a replacement cat? Or
All about
something.
Yes.
Follow up.
So, Evadney, as we've come to the end of our discussion, I'm going to put you in the hot seat. I have 3 rapid fire questions to ask you. This is just for the fun as we're winding down. And I don't want you to give it a lot of thought. Just let us know, just for the fun of it. What's your favorite food?
Ackee and saltfish.
Okay, if you don't live in Jamaica, ackee and saltfish is our native dish, and it's delicious. So I understand why she said that. Number 2, on your bucket list, where would you want to go in this world before? What did you say?
Switzerland.
Oh, you know something?
Switzerland and the Aurora Borealis, which can be seen in Switzerland, but I want to go Switzerland.
Listen,
Aurora Borealis.
I think my listeners are going to think I have a thing with Switzerland because the amount of people
Yes?
who love Switzerland. Yes.
Really?
Yes.
On your podcast?
Yes. At least 3.
Oh,
Maybe I'll plan a group trip. How about that?
yes.
Although we'll be coming from different parts of the world, we'll meet in Switzerland. Finally, what's the best show you've ever watched? Whether
Hunt
it's
for Red October. Hunt for Red October.
A Hunt for Red October. Okay.
Yeah.
You didn't even have to think twice about that. Okay.
No,
Love that.
no.
Well, Evadney,
No.
you have to promise me one thing. Are you ready?
Okay, before I promise one thing, I want to quickly say one thing.
Yes.
So your podcast crew, that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. That's
Absolutely.
taken from one of my mentors, Maya Angelou,
I know.
and I bow with that. So I'm game for your other question.
I mean, you just have to commit to coming back and chatting with us again. Will you do that?
Oh, sure. Certainly. I have lots of gems I would want to pass. So I know this time is a bit abbreviated. So I sure would.
Okay.
Thank you
Well,
for having me.
it's been a wonderful time chatting with you. I feel like you were reading my brain because everything that you were saying, we're definitely on the same wavelength. But
Thank you.
thank you for coming, and we're going to connect again at another time. Okay?
Thank you so much. And thank you so much for your audience for listening and watching. Thank you.
Relationship. That is the key to making our patients feel comfortable, feel supported, feel accepted. And it's down to doing basic things. How would you want to be treated? That's exactly how you need to treat our clients. Because we're all the same. We all want to feel appreciated, supported. We all want to know that you're happy to have us and we're not just a number, we're an individual. So show empathy. Customize your care by using people's names. Fill the gaps. Don't let people feel like they're waiting. Do something to make them feel more relaxed. It may be having a conversation about something other than dentistry. It may be following up on a previous conversation. You know what? The more people feel a part of your team, the more they will gravitate towards you, and the less you have to work at trying to get them back time after time, because they'll be committed to you. So, another wonderful podcast. reminding us that life is better when we live, learn, and grow together. Catch you the next time.